The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name's Mark Ryan. It's a pleasure to be hosting the podcast, and thanks to everyone for listening in. Today is January 31st. It's about roughly 10 days after the inauguration of Donald Trump back into the White House, with former President Joe Biden now leaving. And this podcast is going to just be about the passing of the presidential torch and my reflection as a Republican on some of Joe Biden's healthcare accomplishments. I really do believe Biden deserves credit for some key healthcare accomplishments, so I want to go through them. This podcast was based substantially on a blog I published at the blog tab of healthcarelabyrinth.com on January 20th, 2025, the actual inauguration day. This gives you all the links to other blogs that I mentioned that go deeper into detail. So you can go to, again, the blog tab on our January 2025 blog at healthcarelabyrinth.com to learn more and to go into deeper detail by reading other blogs. I will read out the dates of those other blogs on this podcast, though, just for your convenience. So let's get right to it. We'll take our normal 3 breaks to divide this up. And so again, on January 20th, it was Inauguration Day, and the torch was passed from President Biden to President-elect Trump. He is only the second president to serve non-consecutive terms, in this case 45 and 47. The other president to do so was Grover Cleveland, who was the 22nd and the 24th president. Many have argued that Joe Biden's presidency will be remembered as less than stellar. But again, I wanted to take this chance today, even as a Republican, to reflect on some of Joe Biden's healthcare accomplishments as he leaves office. So what are my views on healthcare? Well, as I've told you in the past, I am somewhat unique and a bit of a maverick on healthcare issues. Part of my college discipline was in economics. As such, I studied how the market works, consumer behavior, and micro and macro trends. I was also in politics before making my leap to healthcare. As a state budget director, I was known as a fiscal disciplinarian who always sought low taxes and a balanced budget. At the state level, we did not have the ability to deliberately deficit spend as they do every year, it seems, in Washington, D.C. Even then, though, I was always on the lookout for good investments in healthcare, whether children's healthcare, long-term care, supportive housing, or HIV/AIDS investments. After leaving government and entering the world of healthcare, I came to the ultimate conclusion that affordable universal access makes sense for the nation. It is both moral and makes economic sense. If healthcare is not an absolute right, it is damn well close to it. That's the moral part of healthcare. On the economic side, America has crafted what I believe is a bad economic deal in terms of healthcare. There is little value unless you are among the well-heeled or strongly insured who can leverage what is technically a strong technology-driven on-demand healthcare system in America. But from the viewpoint of the vast majority of Americans, we spend the most of any developed nation and have the worst outcomes. That's the economics of it, the really bad value in the American healthcare system. We have a broken price system. Because of the broken price system and obscene costs, health plans have traditionally focused on how to limit services, whether through prior authorization or claims denials. Due to the obsession with utilization management, little attention has been paid to primary care, health and wellness, and disease and care management. A lack of investment in market forces in healthcare have virtually crippled primary care in America. Lastly, America has fundamentally missed on the issue of affordable universal access. With the passage of the Affordable Care Act, there was some hope that America would make inroads here, and admittedly, it has helped. But we still have a rough 8 to 10% uninsured rate in America, tens of millions of Americans. What's more, we continue to have a nation of underinsured too. High prices and admittedly overly rich benefit designs have conspired to create a category of people who technically have insurance but cannot afford to use it most of the time. Taken together, we have perhaps 85 million uninsured or underinsured Americans, about 1/4 of the population. In short, investing in and reforming healthcare could mean huge economic dividends. Over time, it would lower healthcare costs and improve outcomes. To learn more about my views on what needs to be done to reform healthcare, see the Healthcare Reform series at the blog tab. The 2024 blogs are May 27th for my overview, and then June 10th, June 13th, and June 17th for the details on the three main tenets: affordable universal access, pivoting to care management, and price reform. The series is based on a much broader look at healthcare reform in my book, The Healthcare Labyrinth, that is also available at healthcarelabyrinth.com and at all leading bookseller sites. It's available in print, audiobook, and ebook forms. With that, we will take our first break, and then we'll come back to tell you about what I see as two very key healthcare reforms by former President Biden. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about the transfer of presidential power on the recent Inauguration Day, the so-called passing of the presidential torch. And I'm here as a Republican reflecting a little bit on former President Joe Biden's accomplishments on healthcare. So I promised to cover sort of two key healthcare accomplishments. Right before the break, I painted a bit of a dreary picture of healthcare, but it would be wrong not to recognize some of the progress President Biden made on the problems we see in healthcare that I outlined. To his credit, Biden had healthcare accomplishments on many fronts. I want to focus again on two of them, and they tie back to the three main problems I raised: price, primary care and care management, and insurance access. So let's first talk about the first major accomplishment that I see from Joe Biden, and that's coverage expansion. While President Obama deserves the most credit for the ACA, Joe Biden was his partner, and he continued to make critical investments in the program when he became president. He endorsed the twin pillars of the ACA's coverage whenever he could: Medicaid expansion and exchange enrollment. Ironically, many red or purple states expanded Medicaid under Trump's first term as Trump 45. Biden continued, though, to encourage state expansions, and a few states converted during his tenure. We still have 10 holdout states. As well, Biden worked with states to expand coverage and tenure and streamline eligibility for certain populations in Medicaid. While Trump 45 worked to limit enrollment in the exchanges, Biden undid many of the misguided policies of the first Trump administration. He lengthened the open enrollment period, expanded special enrollment periods, invested in marketing and outreach, and overall touted the program whenever he could. Biden's policies had a positive impact on premiums. They went lower. Enrollment, it went higher. Financial stability, it became much better. Plan participation, it increased dramatically. Plan choice, it increased dramatically too. And network and provider access, again, they increased dramatically. Enrollment continually increased during his tenure and now will reach over 24 million coming into 2025. In summary, Biden fought back on all the limitations to Medicaid and the exchanges that Trump 45 put in place. While the uninsured rate generally rose under Trump, it dropped precipitously under Biden. Because of Biden's work as vice president and president, almost 47 million people today have coverage. As I note, it is not a perfect world due to costs and the plight of both the uninsured and underinsured. But Biden deserves the most credit of any president in the past few decades for following through on a true coverage agenda. I would note two critical outcomes here. Despite the state of primary care, access to upfront services has increased because of coverage. And despite the critics' complaints that the ACA is overly expensive, to some degree it is and changes need to be made, we did not see the huge healthcare cost rise many predicted when the ACA came in. As a recent study in Health Affairs Forefront blog found, the ACA has reduced, not increased, expected costs, and that the country overall benefited from tens of millions gaining coverage. As the number of uninsured fell, the moving average of national healthcare expenditures growth decreased until COVID-related spending began in 2020. See my blog on why the GOP should safeguard the ACA at the blog tab, the November 14th, 2024 blog. With that, we'll take our second break before we come back to talk about the next major achievement on the healthcare front of Joe Biden. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about former President Joe Biden's accomplishments under healthcare, focusing in on two very important ones. Before the break, we talked about the fact that Joe Biden really promoted coverage in both Medicaid and Medicare. And because of his work both as vice president and president, so many tens of millions of Americans today have access to healthcare coverage. It's almost 47 million more people. So now I want to talk about the second major accomplishment, which is Medicare drug negotiations. I have made the case that price is fundamentally broken in America. Whether for medical services or drugs, most price is not based at all in the reality of cost. Hospital prices are obscene, as are provider costs overall, but so are drug prices. If Biden did not make progress on price overall, he did begin to address the issue of drug pricing in America. Appropriate drug use is key to bringing down costs in the healthcare system globally. At the same time, high drug prices force millions to forego necessary doses or drug regimens altogether. The drug channel lacks transparency. Actors, such as the brand drug makers and pharmacy benefits managers, perversely work relationships intended to benefit themselves and not the public. It is unjustifiable that America has the highest drug prices in the developed world. Prices are many folds more than in other rich nations. Between 2/3 and 3/4 of big pharma profits in a given year come from the United States. America does little to nothing to control drug prices, while other developed nations use national negotiations, comparative clinical and cost effectiveness, and international reference pricing, benchmarking price to comparable nations. There is plenty to hate in the Inflation Reduction Act, including misguided changes to cost sharing for the Medicare Part D program, which actually is jeopardizing the stability of the standalone PDP program. But the Medicare drug negotiations law is not one of the things to hate. The Medicare drug negotiations have only just started. The first 10 Part D drugs were negotiated in 2024 and will take effect on January 1, 2026. In a parting shot, Biden unveiled the next 15 drugs early. These will be negotiated, hopefully, in 2025 and go into effect on January 1, 2027. The Biden administration says that about 1/3 of all Medicare Part D drug spend will be impacted by the first 2 years of negotiations. Now, I am the first to admit that the negotiation process needs to mature and bear much more fruit. The drug negotiations dropped those 10 drugs' prices by 22% on average on a net price or post-rebate basis. So the record is mixed so far. The 2026 prices for these 10 drugs would appear to be below some other smaller government programs that negotiate prices, but they are still well above prices in other developed countries. See my blog on this subject at the blog tab of healthcarelabyrinth.com, the December 26, 2024 blog. But Biden should be cut a break here. It is easy to Monday morning quarterback. The program is novel for America, and Biden had to take a go slow approach initially given legal and political issues. The program can and should mature over time, including better and better review of comparative clinical and cost effectiveness. In short, the Medicare drug price negotiations is a seminal event for America. It is the first recognition that something needs to be done on drug pricing and healthcare price as a whole. And for this, we should thank Biden. It can work if given a chance. Those in my party would argue that the Medicare drug price negotiation law distorts the free market and will stifle innovation. This is the clarion calls of the brand drug lobby. On the first issue, the drug market, which is cloaked in the unseemly opaqueness as well as complex and chicanerous reimbursement schemes, is not a free market. The economic rules I learned about some 40 years ago now in college do not apply to it. On the second issue, there is little evidence so far that innovation has been stifled, despite the catcalls of big pharma and their pinstripe lobbyists. There are many avenues, including government and multinational research programs, to deal with innovation issues if they occur. Further, a review of innovation would suggest that brand drug makers are investing in innovation for themselves and not with the overall American public in mind. Lastly, how do we explain to all of those cut off from a chance at affordable medication that we will continue to subsidize low prices in other developed nations? So as he leaves office, again, thank you, President Biden, for your conviction on coverage as well as drug price reform. With that, we'll take our third break, and we'll come back to talk about what may be in store on these issues under a Trump 47 presidency. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We've been talking about two very critical accomplishments for healthcare by former President Joe Biden, the expansion of coverage and Medicare drug price negotiations. We're now going to talk about what may be in store for these issues under Trump 47. As President Trump again takes office as 47, it is hard to know where things will go on these two issues. Trump and the now fully GOP-controlled Congress want to extend the tax cuts, and that will take trillions in spending cuts under the budget reconciliation process. I have made the case, perhaps with an air of hopefulness, that radical changes to healthcare will not occur. After all, the vote counts in each house are tight, and there are some notable moderates who could hold sway. I also believe that some changes need to occur in government programs and healthcare overall, lest we become even more unaffordable. Two good examples. We do need to rein in Medicare costs, and that includes changes in Medicare Advantage. Number two, I do think Medicaid reform needs to happen. I don't favor the bludgeon of a block grant approach, but a carefully crafted and nuanced per capita cap program with well-thought-out escape hatches for economic downturns and demographic changes might bring more accountability in a program that does need reform, as much as I support it. I also believe that there are trillions in savings over time through reform that does not have to impact coverage. One great example here, finally standing up to the hospital lobby and endorsing site-neutral payments. See my blog on this topic at the blog tab of healthcarelabyrinth.com, the July 8th, 2024 blog. To the critics, other studies show you can make money at a hospital with Medicare payments. See my blog on this subject at the blog tab of healthcarelabyrinth.com, the August 26, 2024 blog. But the process we will see in Washington in 2025 undoubtedly will have major impacts on healthcare programs and coverage. See my blog on all the spending cuts being put on the table right now at the blog tab of healthcarelabyrinth.com, the January 9th, 2025 blog. Even if seismic changes are not made in healthcare programs and structure per se, the adoption of spending cuts in the budget reconciliation process could erode some of the coverage. Consider this. 9 states have so-called rollback triggers with regard to Medicaid expansion under the ACA. Reductions to state matches in Medicaid could mean these states eliminate their expansions, and it could impact up to 3.7 million people who have gained coverage. Other states could roll back too. Here is hoping that lawmakers and policymakers think through the long-term implications of their decision before putting the mammoth budget reconciliation bill to a vote. With that, we will conclude this edition of the Healthcare Labyrinth podcast. We'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.